The features of this variant strain, which I know the CMO can comment more on, and could attribute, possibly, with more work to be done, more testing to be done, the widespread disregard for the protocols, the non-wearing of masks, the crowded situations, the illegal parties and social gatherings across the island, and also the increasing indication of symptomatic positive cases. All of this combined could be contributing to the rate of spread of the virus in the population. The issues around the variant strain is concerning. I mean, it has taken us some time to get the results of these tests because we don't do the tests here in Jamaica. And so we are moving to ensure that we have the necessary equipment to allow us the capacity to test for that variant strain. I understand from the technical personnel that we will need approximately 60 million Jamaican dollars to acquire certain pieces of equipment which will be lodged at the Public Health Lab, which will contribute to testing here in Jamaica for the presence of variant strains, and in this particular case would help us to assess the prevalence of this particular strain in the population. We're also moving, as said earlier, to look at an alternative source or another source for testing, not just at CARFA, but in the US, in Florida, and arrangements are being made to increase that agreement so that we can have testing for the variant strain in that location. I want to stress, and again, our technical person, the CMO, can comment more on this, that the presence of the variant strain really requires the very same response as is the case with the presence of the regular strain, if you will, in the population, starting with observing the protocols. That's absolutely critical. And also to say that the vaccines that we have received is in fact effective with dealing with the variant strain. So we just have to continue to follow the procedures, the protocols, and we will, if we are diligent to those protocols, benefit from controlling and overcoming the strain, both strains that are in the population based on the tests that have been done. I want to also indicate that our presence of workplace clusters, or the increasing discovery of outbreaks within the workplace, is a concern to public health. We feel that it is an indication that protocols at the workplace are not being followed diligently. And indeed, we want to remind employers, to the extent that you have to work from the workplace, that a review of those protocols be done to ensure that we minimize spread within that work environment. In Kingston and St. Andrew alone, the health department is currently managing some 46 active workplace clusters. And this is a lot to manage with limited personnel that we have. But it is an indication that we are having increasing numbers of outbreaks within the workplace. Onto hospitalization, the increase in the number of COVID-19 cases in the country remains a cause for concern from the perspective of hospitalization and the capacity of our health system to respond. Present state of hospitalization continues to be alarming. 13 of 22 hospitals across the island are in the red alert zone, which means that they have greater than 84% occupancy level for its isolation capacity. 12 of the 13 hospitals are at 100 or greater capacity percentage. The current hospital census shows Cornwall Regional Hospital, Annotto Bay, Port Maria, Mandeville, Maypen, Kingston Public, Princess Margaret, Percy Jr., St. Anne's Bay, University Hospital, the National Chest and Spanish Town hospitals have all exceeded their capacity to house patients who require isolation care. All 4 regional health authorities have 2 or more hospitals in the red zone, and the red zone, again, is 84% or greater occupancy. The Western region has 2 or 4 hospitals in the red zone and the other 2 in the amber zone. The Northeast region, 3 or 4 hospitals in the red zone. Southern region, 3 or 5, and Southeast region, 5 of 9 hospitals in the red zone. Across the country, the average number of daily admissions to COVID-19 isolation wards was 49 for the week of February 22nd to 28th. That has increased with the increasing rate of spread to 56 for last week. So 56 daily admissions for the week of March 1 to 7. So clearly going in the very wrong direction and adding to the stresses of the public health system. So our staff are experiencing stress and fatigue, as we have said. It is a difficult time for them. And again, this can be averted if persons observe the protocols. And I'll say again, as I've said before, expect longer waits. The instructions to our public health institutions is to not turn away anyone. As I have said, even if you have to triage and assess under a tree in the parking lot, we should do that. And I understand the perspective of the healthcare professionals. I know it's a difficult time, but such is the nature of the job. And I think for the overwhelming cases, they understand that and they're willing. What I'd ask on the part of the Jamaican people is to exercise some patience and understanding, because there's so much capacity and no more, so much room and no more. And we are likely to see the challenges associated with the overcrowding. I want to turn now to what the Prime Minister commented on, and that's vaccination. Again, to support what was said earlier, place on record our appreciation to the Indian government for the 50,000 doses of vaccines that have arrived just a short while ago. And we expect, is it this week or early next? Yes, this week. Another 14,400 next week, 14,400 from our COVAX facility, which will make a total of 64,200 in phase 1. And as was said earlier, there's a process. There are groups that are going to get priority in the first instance, or healthcare workers, the JDF, the JCF, and vulnerable groups who will be administered during the course of March. We expect in week 1 to administer some 17,050 vaccines. In week 2, 11,430. Week 3, 19,580 to make up the total. And the PS is going to come and put up a few slides to explain some of the finer details of the vaccine plan. There are still some questions that I know will be asked. On Thursday of this week, during our regular COVID conversations, we will go through in finer details the structure that has been established in terms of the vaccine plan, and hierarchical structure involving functional management, oversight, the role of the regional health authorities, persons who have been specifically assigned to deal with logistics, to deal with human resources, to deal with the clinical side of administering the vaccine, the role of the private sector or private doctors, and I could go on and on. So this Thursday, we will go through that very important detail, or set of details, to give the public more information on this process. Before he comes, I just want to reiterate that we are making progress, and the comments that have generated alarm and perhaps concern, comments coming from myself as minister, is not intended to scare anyone, but certainly to explain to the country that there's a lot that we need to do, and all of us have a role to play. But I think the arrival of the vaccines is a good start to what I consider to be the most effective arsenal or effective response to COVID-19 and the virus, but it should not make us complacent. We must still wear the mask, physical distance, and sanitize, because there's still a fairly long way to go. I think we're getting there. What we need now is take up. But in the meantime, please continue to observe the protocols. So I'm going to ask the